Good afternoon, everyone, and welcome to the Baldrige Foundation's Institute for Performance Excellence webinar, Promising Practices from a Community of Excellence. Before we get started today, I want to take a moment and recognize all of our great sponsors and a special thanks to the members of the Mac Baldrige Society who serve as trustees of the Foundation's Institute for Performance Excellence and our newest Mac Baldrige Society member, About Healthcare. Today's topic is focused on developing a scorecard for community performance excellence. Communities around the nation struggle with measuring their performance. What measures truly indicate whether or not a community and its residents are thriving? Communities of Excellence 2026 and Excelsior Springs, Missouri, a member of the National Community of Excellence Learning Collaborative, set out to answer that question. And today's presenters will showcase the promising practices they have identified and preview the model they are now developing to share with other communities on their journey to excellence. So here's today's agenda and featured guests. Our guest presenters include Kim Halfhill, founder and principal consultant of KH Consulting, and Stephanie Norling, director of Communities of Excellence 2026. So now I'll turn it over to Stephanie and Kim to get us started.
Well, good morning, everyone, or good afternoon, depending on where you are. I'd like to make just a couple of introductory comments before I pass this over to Kim. Here within Communities of Excellence 2026, we've been wanting for some time now to develop a scorecard for all of our communities. Accessing meaningful data and filtering through the vast amounts of data available are challenges that basically every one of our 22 communities that we work with have described. In addition to just having the data that you need, the leadership capacity and capability within communities to make sense of it and to use it to make decisions, for comparisons, for benchmarking, to tell stories is also absolutely critical. When we started developing a common scorecard for our communities, we didn't even know the right questions to ask or where to start with such a huge undertaking. Last year, we received a Robert Wood Johnson Foundation Data Across Sectors for Health mentorship grant in partnership with Thrive Excelsior, the Excelsior Springs Communities of Excellence Initiative. This opportunity is not only allowing us to address these challenges at the local level within Excelsior Springs, but we're also using this mentorship to guide our efforts within Communities of Excellence and the communities that we work with. So now I'm going to pass this over to Kim so you can hear about the Excelsior Springs story.
Hello, everyone. It is wonderful to be with you today. So as Stephanie said, several months ago, our team, along with the Communities of Excellence 2026 National Learning Collaborative, was awarded a grant from DASH with support from the Robert Wood Johnson Foundation. Through this project, we wanted to answer the question, how can we best utilize this cross-sector data to improve our local determinants of health, and eventually with the end goal of increasing life expectancy in Excelsior Springs. One of our major goals, of course, for this project was developing that community scorecard. So over the next several minutes, I'll tell you about how our work progressed and what we've learned along the way. But first, I wanted to just a few minutes to tell you a little bit about the place that I call home, Excelsior Springs, Missouri. Excelsior Springs is about 30 miles north of Kansas City, and it really is the best of both worlds. So 10 miles down the road in one direction, you are to a busy suburban area, and then 10 miles in the other direction, and you are in a very rural community with farmland and cows on either side of the road. So it's really a great place to be located. Our population within the city limits is just shy of 12,000. And then our larger community, which really aligns closely with both our zip code boundaries and our school district boundaries, that population is around 17,000. In our community, we are fortunate to have wonderful schools and a great mix of jobs and healthcare, the retail and service industry, manufacturing, and education, just to name a few. A little bit about our history. Excelsior Springs became a mineral water attraction, or a spa city, back in the late 1800s, early 1900s. And today it is still one of the most intact spa towns in Missouri. So come see us for a long weekend. People today are attracted to our natural beauty because of our hills, our valleys, and a lot of architecture that still remains from the past. And of course, all of this makes one of our main industries today is heritage tourism. So I want to tell you a little bit about why we felt like communities of excellence was really the right approach for our community. Of course, within the communities of excellence framework and just kind of overall context or setup, one of the key pieces is really having a supportive backbone organization to give some structure to the process. And in our community, the city government provides that structure for us. Our city manager actually became aware of communities of excellence when she was relatively new in her post and felt like it could provide the right framework to address several issues that she was concerned about in our community. We chose to participate in the Learning Collaborative because we really felt like learning and applying the framework would strengthen our community in so many ways. Some of our main goals that we were hoping to achieve were really bringing more perspectives to the table, especially people who were impacted by the decision. We wanted them to be a part of those decisions. We were hopeful, and it certainly has, that this process, this journey would help us move away from kind of an us versus them mentality. And I think we can all agree that that is something that is more important than ever today. We also wanted to establish the expectation in our community that as a community, we really share ownership in decisions, and then we also share ownership for those outcomes. And of course, we wanted to begin really fostering a culture of using data instead of just the word on the street to really make these community decisions. So next, I'd like to walk you through the steps of our Communities of Excellence journey. So you know why we started, so let me tell you a little bit more about our journey. So fall 2017 was our first year in the Learning Collaborative. We were part of the inaugural cohort of Communities of Excellence 2026. And with the city government as the backbone organization, our city manager formed a leadership team, or a steering team, as we later decided to call ourselves. And even though the city is the backbone, this effort does not function as a city board or committee. Just a few months later, we conducted a brief community survey to help us pinpoint some of the most strategic challenges or the most significant challenges in our community, which later became our strategic challenges that we're addressing through a strategic plan. So 2018, our second year in the Learning Collaborative, we worked on better defining our leadership structure, continuing to learn more about a systems approach to community improvement. And as a part of that, we attempted, and attempted being the key word here, to launch our task forces or work groups, one for each of the preliminary 3 strategic challenges that we had identified. So in 2019, after many, many lessons learned, we were able to successfully relaunch our task forces. And we also spent some time in 2019 trying to really get our hands around the data a little bit better. Through the work of the task forces and working a little bit more with the data, we were able to better refine our strategic challenges. So in 2020, we spent a lot of energy doing exactly what you all did, is figuring out how to navigate our world and our work in a COVID world. During that year, we were able to make some significant steps still. We branded ourselves as Thrive Excelsior at that point, giving us just a lot more momentum to engage the community in our work. And we did attempt to identify some preliminary metrics to measure our performance, as well as formalize some of our process. So 2021, we're a good chunk of the way through the year here, has been an exciting year for us. It was our second opportunity to submit an application for Communities of Excellence that responds to all of the criteria in the framework and receive feedback on that. We've spent a lot of time really working on increasing engagement and continuing to think about how we navigate and maintain that engagement in our COVID world. And of course, the reason that we're here today is to talk about data and a community scorecard, and that has been an exciting part of our journey this year. So as we kind of move through this process and this journey of developing the scorecard, I also want to give you a peek at our strategic planning process so that you can kind of start to see how all of those pieces have come together and led us to this moment with the community scorecard. So this is really the process that we use to identify our strategic challenges. And of course, you can see in that graphic that the first 2 steps are really all about data. Our process begins with data collection, which I'll talk more about in a moment. And of course, from there, we analyze the data to use it to help us define the problems or really the areas of greatest need or concern in our community. We continue on through our strategic planning process by developing new or evaluating any existing strategies, and of course, then develop and deploy those accompanying action plans. And currently, our whole process takes about 12 months, but with like all things, we are continually reevaluating that and thinking about really what's the best process going forward. And I've talked about lengthening that timeline. So let's talk about how we get our hands on some of that data. Early in our first year, we wanted to engage our residents and other key stakeholders to get feedback about what they saw as the greatest challenges facing our community. This is, of course, a significant piece of the Communities of Excellence framework. We conducted a small community survey, and it was far from sophisticated, and our response rate actually fell short of being considered a statistically valid survey, but we knew that it was a starting point for us. The feedback from our community was actually pretty clear on the survey in terms of what they were most concerned about. And we said that this very first survey was just a way of quite frankly, helping us to know which rocks to look under, right? We knew that we needed more information to guide our planning process, but this survey told us where to begin. In the year after the survey, we hosted a community forum of more than 40 residents and community leaders from all sectors. We presented the results of the survey and asked them to tell us what they knew about problems in these specific areas based on their experiences, both as residents and their professional knowledge and expertise. And finally, we reviewed secondary data. Some of our primary sources for that were Census Bureau, American Community Survey data, as well as the Missouri Health Atlas and some community needs, health needs assessments that our health department generously shared with us. Reviewing all of this data and the engagement and feedback from our community together helped us better understand the greatest challenges in our community and really think about how they impacted residents. So let's talk about what we learned. So in the first survey, as well as the subsequent two that we've conducted, our residents and stakeholders consistently expressed the most concern over healthcare, the economy, and housing. And we've actually since added community engagement as a fourth priority just this last year. Our community surveys continued to show an increase in concern around residents really getting involved in their community. And in addition, we believe that this fourth priority will help us to continue to build capacity for the work that we want to do. But back to our first strategic planning process in 2017 and 2018. While we were reviewing the secondary data, we discovered that the life expectancy in our zip code was 8.3 years less than that of communities 15 miles down the road. Now, I want to make sure you don't miss that, so I'm going to say it again. The life expectancy in our zip code was 8.3 years less than that of communities just 15 miles down the road. And as we started to examine the factors that really influence life expectancy, we learned more about the social determinants of health. So understanding these social determinants of health really helped us make sense of our low life expectancy and how it really tied to all of the things that our residents told us they were concerned about. Now, if you're not familiar with the social determinants of health, the CDC defines them as the conditions in the environment where people are born, live, learn, work, play, worship, and age that can affect a wide range of health, functioning, and quality of life outcomes and risks, right? So this all sounds pretty familiar to what we're working on. As you can see, they fall into these 5 broad domains, which include healthcare, education, economic stability, civic engagement, and connectedness to the community, and then the built environment, which includes everything from housing to access to parks and trails. And this knowledge really helped us kind of connect those dots and align our priorities. So where has the work of the last 4 years led us? Well, we learned early on that our community both residents and other stakeholders, they were concerned about, again, these three broad issues: health and wellness, housing, and the economy. And of course, now we've added community engagement to that list. Through additional surveys, focus groups, and the work of our task forces, we've refined our work towards 4 specific goals, all aimed at increasing the lifespan of our residents through outcomes related to these social determinants of health. This aligns with our mission and our vision. We want our community to be a place that matters and where our people matter, a place that among all someone's choices, we are the favorite. Whether you're looking for a long weekend getaway, because remember, heritage tourism is a significant economic driver for us, or where you are looking for a place to put down roots with your family. This is really our vision and our desire for the future. Our mission is focused on how we can create this thriving and sustainable community, both now and in the future, for all generations. So I mentioned our task forces. So let's talk a little bit more about how our leadership system is set up. One of the important things to remember in a community is that there is no one boss or CEO. And we like to say that in a community of excellence, the process becomes the boss. Because of that, an effective leadership system is really very important. And so I'm going to just quickly walk you through this and kind of give you a sense of how we let the process be the boss in our community with this leadership system. So we have 3 primary governance pieces in our system. Of course, our backbone organization is the City of Excelsior Springs. We also have a process manager or community coach. That's the role that I play. And I work closely with our steering team and all of our task forces really to provide some process management, facilitation services, and then implement our communication strategies. We also have an ethics and inclusion task force. They are part of our governance structure and provide oversight and direction to ensure that our strategies are both equitable, ethical, and inclusive. And then, of course, our steering team sets that strategy, but also provides some governance and oversight to the whole effort. So our strategy task forces are those green boxes you see. And of course, we have one for housing, health and wellness, economic vitality, and engagement. And they are all really focused on digging deep into those strategic priorities that we've identified, developing some action plans, and then deploying those action plans. And of course, our residents and other stakeholders are a vital piece of determining the direction of our strategy. So taking a look at this next slide, as I mentioned earlier, the Communities of Excellence framework really provides a lens for us to see our community as a system. Because of that, we know that all sectors are interrelated, and to address any one challenge, we really must consider how it is impacted by other parts of the system. And this cannot happen without cross-sector engagement that allows us to together to talk about the challenges in our community across all areas of the community. So looking more closely at our task forces, we can really start to see what this looks like in practice. Now, again, I don't want to spend too much time on this, but I do think it's important for you to see the diversity of industries and sectors that we have on each task force. We wanted to bring together as many experts on the issues as we could, but also ensure that different stakeholder groups and perspectives were represented at the table. And again, I'll just make note that our steering team runs through all of the task forces. Each task force does have a steering team member on it. We're doing all of this work, we're engaging expert stakeholders and residents, and we're really trying to untangle the challenges we've prioritized, but we keep hitting the same brick wall: a lack of access to reliable data, and truthfully, a deficit in our skill set of how to analyze data and use it for decision making. Now, of course, we weren't the only ones who realized that this was a problem. Each year in our feedback report, our reviewers highlighted the ability to systematically collect and utilize data as a significant opportunity for improvement, and we knew that this was something we had to prioritize. So here we are today, trying to answer the million-dollar question. How can we best utilize cross-sector data to improve those local determinants of health and eventually increase life expectancy in Excelsior Springs through our DASH grant. So let's take a look at where we started to give you a better picture of kind of where our journey has taken us. This chart shows the indicators that we were tracking back in the fall of 2020. They are important measures and they're related to our strategic plan. But even then, we realized that they weren't necessarily the best indicators, and they certainly didn't tell us what was happening across the entire system of our community. So when we started on this journey to develop this scorecard, this community scorecard, our partnership with Communities of Excellence to do this and their support really helped us with two key pieces of the process, both which have accelerated our learning in ways that I cannot, I can't say how much about it. It's just been a great partnership to work on this. Two of those areas were in a scorecard inventory, looking at the community scorecards of other communities, and also in a literature review. So on the screen now, you can see that we were able, as our Communities of Excellence National Learning Collaborative, we inventoried or reviewed the metrics that 9 different communities were using, ranging from rural to metropolitan communities. On that list, there were 169 individual indicators that our communities were tracking. And when we kind of kept moving down in a funnel to make that list smaller, there were 31 subcategories. And then we finally landed on a list of 9 broad domains that I'll talk more about soon. We were able, with our partnership with Communities of Excellence, to do some additional research. We also have reviewed the indicators used by select communities across the country that have successfully developed a balanced scorecard. In addition, we also took a look at indicators chosen by the Wellbeing in the Nation, or the WIN measurement framework, which offers a set of common measures to assess and improve population and community health and well-being. Then, of course, we looked at Healthy People 2030, which many of you might be familiar with. And we also looked at resources from the Community Indicators Consortium. So the next piece of this was some significant findings in the literature review, and I'd like to highlight those for you. So one of the things we learned, and again, no surprise here, communities who were the most successful at doing this, their residents really had a voice in the process of deciding what was most important to them. So that was a big finding for us that really aligns with what we know through the Communities of Excellence framework. We also were able to identify several guiding principles for selecting indicators that were cited across multiple sources. So one of them was just that community indicators really need to measure meaningful dimensions of community life, right? So we're not just measuring for the sake of measuring. The metrics must be important within the community. We know that it's important for these metrics to be available at the community level. So think census tract or a smaller area, a similar small area within a community, like a school building kind of, district or zone maybe. That was really, really important, right? So in this particular case, looking at state or even county data might not be that helpful. It's really about getting down to that neighborhood level. Of course, the data needs to be credible and reliable over time. Metrics should be routinely collected and available on a predictable cycle over time. And then, of course, it's important that those are measures we can count on year after year to be there. And of course, sources that we trust to really have reliable data. And we want to make sure that they're comparable with other communities. So from community to community, but we also want to be able to compare at the county, state, and national level. So we also learned that it is really important to begin with the end in mind when you're designing a scorecard. And that means selecting useful indicators that can fuel and measure change. So the data should be useful in guiding community policy decisions and remain relevant to community work. All right, and so this next finding is really when we started to realize that maybe this project wasn't going to look exactly like we thought it would. So we learned that most community scorecards really rely heavily on census data. Now, of course, we talked about how Data needs to be timely. We need to be able to measure in real time, and it needs to be available down at that community level. And so those two things don't always go together, right? So that census data, it's reliable. We know we can get it. Oftentimes we can get it down to that census tract level, to that neighborhood level, but it's not real-time data, right? We don't get our hands on it very quickly. And so we may need some additional data, some locally collected data, to help give us those real-time insights. And I'll talk more about this as we move through our journey. But our approach to dealing with this is choosing some top-level indicators, so the main attraction, if you will, with a supporting cast of 3 or 4 related indicators in each domain that are more timely. Typically thinking leading indicators that point to that top level, and then lagging indicators to support them. So speaking of domains, also in the literature, we discovered that if there is a magic number of domains for a community to be measuring, 5 is really a good number. It's not too few, it's not too many. It gives a nice overall view of the system, but it's also not too many different domains and metrics to measure. We also learned that there is really a delicate balance between using metrics that are easily attainable and metrics that require a more in-depth user analysis. So think complex versus accessible metrics. The reality is that many communities don't have sophisticated data users available. So the metrics that they select need to be accessible to that community, no matter where they are on their data journey. And of course, communities with advanced data collection and analysis capacity really could benefit from a more sophisticated analysis. But we want to make sure that we're taking communities into consideration no matter where they are. So those were our big findings from the literature review, and it really led us to establish 2 kind of guidelines or guiding principles for selecting our indicators. The first thing we knew was that we really needed a definition for community indicators. The Communities of Excellence Framework definition of metrics and indicators, it's a broad definition, and it includes everything from process measures to outcomes. So we felt like it was really important to supplement with something to better define the types of indicators we would include on our community scorecard. This definition from the literature helps give us a clear picture of the types of indicators we wanted to consider. And we really kept coming back to it almost as a litmus test to decide whether an indicator should make the cut onto our scorecard or not. There were really 3 key points in this definition for us. One, it's about that system of measures, right? So it's telling the story across the whole system in a community and not just looking at one piece or another, right? It's about those interrelated measures. Neighborhood level information, our community information, of course, so we've talked about that some already. We know that that's really important. And then this last bit, community building and policy making, right? So using data for decision making, not just for the sake of measuring. So this is a definition that we just kept coming back to and back to again to really make sure that we're choosing the correct indicators. One more list that we developed to kind of help us in this process was just a set of criteria for choosing. And again, this is kind of thinking of those top level indicators, right? So they might not look at it, that local real-time data, but thinking more of those indicators that might pull from census data or other sources like that. So again, available at the neighborhood level, census tract is a great option for that. Connecting to other indicators, like we talked about, that definition is really important. Measuring those meaningful dimensions of community life that are universal to all communities, right? So even though this scorecard is for our community, for Excelsior Springs, we wanted something that could be universal to all communities so that we can compare and benchmark. We know that the data must be derived from a credible data source, and those updates must be at consistent intervals. And then again, we talked about this a little, but we want it to be comparable at the local, state, and national level. All right, so let's talk about those domains again. So we identified 9 possible domains for our community indicators. And of course, you can see the first half of the list here, ranging from everything from health to the natural environment. And then taking a look at that second slide of community indicators, you can see, right, so these are all great options. You know, let's have all 9, but we knew we really needed to get that list down because we learned that 5 was really kind of ideal on our community scorecard as we think about that. So where has this work led us? So this is where we are today. This again is very much a work in process. We have identified 5 domains: quality of life, health, housing, economic vitality, and education, and a top-level metric across each category. Of course, we know that this list is far from perfect, but we believe that these metrics really give us a nice snapshot of what's happening across our community as a system. And we believe these metrics will be useful in developing programs and policy over time. And of course, one of our next steps is then to identify the secondary or the leading indicators in each domain. So again, those metrics for quality of life, that life expectancy is our top level metric. In health, it is the rate of chronic disease diagnosis. In housing, we really want to look closely at substandard housing as we're working in our strategic plan to make sure that all of our residents have access to safe and affordable housing. And of course, we know because of the social determinants of health that housing really affects a lot of things in a person. Economic vitality, we are looking at median household income as a way to kind of just give us a sense of where we are and how our community is doing in that area. And then we want to make sure that we are also paying attention to high school graduation rate and just keeping sight of that. Of course, we know that education is a key piece of this puzzle in so many different ways. And then you can also see the source there for our data. So one thing I want to speak to just really quickly as we're looking at those sources. You remember when we were looking at our criteria, we really wanted for those top level indicators, national data sources that would allow us to compare with communities all across the country. And of course, you probably noticed on that source list that 2 of those are Missouri data sets. And of course, you know, I said at the beginning, this is very much a work in progress. That is one that we've really wrestled with about the quality of those particular metrics are really high, right? There's a lot of reason for us to include them, even though they are at the state level and not the national level for comparison's sake. So that's something that we'll continue to wrestle with, but we are really excited to be at this point in our journey. So let's talk about our next steps, right? So this is the beginning. We've said multiple times throughout this journey that, you know, it's a new finding or something learned we knew, a new question we asked just to beget kind of another new question. So our hope is that soon we'll be able to finalize these domains and these top level indicators and really begin working on those additional indicators for each domain. We know that we have got some work to do around data literacy in our community and really just helping, you know, not only our task force members and those kind of stakeholders around the table, but our whole community really kind of raising the conversation about data and how to use it. We know we've got some work to do figuring out how we store our data, you know, what that system might look like, and then how we share it back out into the community. A systematic process for data collection, that's something that we just hope to get better and better at over time. And then really refining our approach to how we use data, right? So getting better and better at data-informed decision-making so that we're taking that data, we're collecting it, we're really digging deep into it to learn about those root causes and how data can help us kind of get better at identifying those so that we are really making meaningful changes in our community. And then I think Stephanie now is going to talk about the next steps for Communities of Excellence 2026 in regards to data.
Well, thank you, Kim. And it's always a pleasure to be working with you on this project. So as I mentioned at the beginning of this webinar, Communities of Excellence 2026 is also developing a common scorecard for all of our communities to use. We've been working hand in hand with the Excelsior Springs group on both projects and are involving the community leaders in our communities to help us identify the most important metrics. At our virtual conference last week, we asked leaders in our communities for feedback on the most meaningful domains to them, according to the scorecard, as well as what types of supporting tools they would want to prioritize initially to accompany the scorecard. In the next couple of months, we plan to finalize the scorecard template with instructions for using it and provide additional tools such as data literacy training guides and other recommendations for using and communicating data. And finally, we're seeking funding opportunities to continue with this work so that we make sure that the project can reach its full potential for our communities. So here's our contact information if you have any questions about what we've talked about today. And I just want to say thank you very much to Kim for being, and to the Excelsior Springs group for being such a great partner in this project and in this work. And I think I will turn this back over to Al Faber now.
Thanks, Stephanie, and thank you, Kim, for such a great presentation. We've got some questions here from the audience, so I'm going to run through those and I'll let you two decide who's going to answer them. The first one is, I don't see any equity measures on your scorecard. Why is that?
Kim, do you want to start?
Stephanie, I bet that one's, yeah, that's perfect. So I was going to say, I bet that one's coming to me. Yeah, so that's a great question. And that is really one that we wrestled with. And I will say that this grant funding opportunity and the learning that's taken place through that mentorship really was invaluable to us and helping us kind of wrap our hands around this. So kind of what we learned through this journey is that individual equity measures at a national level for comparison's sake, we felt like were going to be really difficult to get our hands on in a consistent way over time. And so some of kind of the best practice things that we looked at, instead of having individual equity measures, they were looking at all of the measures that they had identified in those other domains, but we're really looking at them through the lens of equity, being able to segment out that data. And so our approach at this point, and again, this is a very much an iterative process and we're still learning, is that for each of those indicators, and then again, as we develop kind of those secondary indicators, that we will segment the data out so that we're looking at it by census tract, as well as race and ethnicity, by gender, and then either by educational attainment or median income. And we really feel like looking at all of those metrics through those individual equity lenses will help give us a really good picture of where those gaps are in our community. So Stephanie, did you want to add anything to that?
It's very close to what I was going to say. I do want to echo that the mentorship experience has been very helpful for us in trying to explore how best to reflect equity in this data. When it comes to the Communities of Excellence scorecard, I think similar to how Kim has described it, we will most likely be providing recommendations and training and help in how to identify the most important equity measures in each community versus really prescribing specific measures.
Thanks, Stephanie. Our next question is, how have you maintained engagement within your COE group over the last 18 months during the pandemic?
Yeah, that's a great question, right? And we're all still learning about this as we go. We're still up, knee deep in a pandemic. So, we're very fortunate to really quickly be able to make the change, like so many organizations and community groups, to meeting by Zoom. We knew we were at a critical place when the pandemic hit, and we were just really starting to get some good traction and some good momentum in those work groups and task forces. And so we knew that it was not the time to say, we're just going to take a break for a while. It was really important to keep moving forward. one of the things that we did find is that in some ways, because of the relationships and the networks that already had formed and those cross-sector relationships in our communities, people were eager to keep coming together at the table because there was an opportunity to really talk about those COVID challenges. And so early on in the pandemic, that was a helpful way for people to continue to come together. And we really just tried to be very sensitive to the challenges and the struggles that we were all facing during that time, whether it was, trying to homeschool kids while you're working from home with barking dogs. I'm sure that doesn't sound familiar to anyone else. But just being sensitive to that and knowing that we might have to slow down in some ways. If there was a strategy we were working on with our public health department, they've been a little bit busy for the last 18 months. And so it was being sensitive to that, kind of saying, okay, we're going to take a step back from this, but now here's an opportunity for us to move forward in a different way. So, and we are slowly getting back together in person, and that's been exciting as well.
If I could add one thing here, as Kim was talking, that I thought about. Just last week, we had our Communities of Excellence National Learning Collaborative virtual kickoff conference. In the past, it was something we always did in person, and the last 2 years we've done it virtually. And this year, our special guest presenter was Nick Machione. He's the director of the San Diego County Health and Human Services Agency. And his presentation was about their county's response to COVID, both initially and now rolling out the vaccine. And what Nick was very generous about sort of sharing with us is that, there were a few very significant pieces that made it successful. One was the incredible partnerships and relationships that they had developed across the community. But also he was very clear to talk about the important role that both Baldrige had taken within their agency and also with their Communities of Excellence work in helping roll that program out. And so it's a pretty powerful example, and their work with Communities of Excellence changed. It looked very different when pre-pandemic to how they were using the framework and how they were using Baldrige in general. But it was just very powerful to hear how those partnerships, those relationships, and the using of underlying framework really helped them achieve some pretty amazing results here in San Diego County.
Our next question is, do you have plans to get resident feedback on the scorecard?
Yeah, so I'll address that just a little bit. One of the things about the way our strategic planning process is designed, right? Because we know that resident feedback is really important in terms of the scorecard. The way that our strategic planning process is designed, we have already heard from many of the residents in our community, and of course, we'll keep hearing from them in different ways about what their biggest concerns are and what their biggest priorities are in the community. And so we've really addressed those through our strategic plan, which very much aligns with that scorecard, right? And so we know that all of those measures are connected. So our process on our step of getting that feedback for the scorecard was really rolled up early on in that strategic planning process.
Our next question is, what role does the leader have when it comes time to execute?
Yeah, so I will tell you that is still very much a growing edge for us. One of the things that we are still working on internally is really that capacity building and transitioning leadership in our task forces. So you may remember back at the beginning of the presentation, I talked really briefly about kind of those lessons learned from launching and then relaunching our task forces. And one of the lessons that we learned was that while we were eager to hand off the work to the experts on housing or healthcare or economic vitality in our community, we couldn't do it too soon, right? We had to bring them along this journey with us. And so we had to do a little bit of backtracking and regrouping, adapting our processes. And that meant that the steering team initially got much more hands-on in working with our task forces to execute and deploy those strategies. So one of the things that we will be working on late this fall and early into next year is transitioning more leadership and ownership into those task forces. Still with a lot of support from me, from our community coach, but really, helping increase their accountability. So I think the answer to that question is like more to come. Like we'll have a better answer in 6 months because we're really kind of leaning into that and growing into that now. So stay tuned.
Yeah, I would add it's a really important question because it's one thing to have the data and select the metrics, but you also have to build the leadership capacity and capability to use the data to make decisions, to communicate the data to the people that need to have it, to share the data, to teach others how to understand and read the data. So there's a lot that goes with it. That's important as a leader and as a leader to be training others to do. So I think when I think about the communities of excellence role in that too, I think that we have a really significant role in a toolkit or workbook of some part that goes with this that really helps teach our leaders how to use this data, most importantly, tell stories with it and really make the most out of it.
Our next question is, how will you integrate this scorecard in your next COE application?
Okay, can I just tell you how excited I am to do this? And so one of the significant pieces of the framework, of course, category 7 and results, is about responding about what those metrics are and and how you're making progress. So this will be this next application, at least in that, will be the first time that we've had something really solid to put in there. We've gotten great feedback over the years about the need for this, and so we are eager to include this scorecard. Between now and then, I think there will be some shifts and some changes to it as we get a better understanding. But we're really excited to put it in there and then get that feedback on it.
Our next question is, would you consider sharing your resident survey and how did you roll that out?
So yes, we are certainly happy to share that survey. It is still in some ways a work in progress for us, but we are glad to share that. In terms of rolling it out, this is where our community partnerships, and again, thinking specifically of that cross-sector collaboration was really, really key to us. So early in the stages of rolling this out, we didn't have a Thrive Excelsior or communities of excellence following, if you will, right? We weren't branded. Nobody knew who we were. We just weren't there yet. But we had to get this community feedback. So we have these great community partners that already had these channels and these networks into the community. So they were wonderful about sharing on social media and really pushing that survey out there when we didn't have our own channels or platforms yet. We also, pre-COVID, were able to do a lot of road shows and go and just talk briefly about this endeavor in our community and really encourage community survey. So that was a great way to get buy-in across the community, just kind of utilizing some of those channels that we had already built through community partners.
We've got time for one more question. So who's this from? B. How do you connect the actionable work of Communities of Excellence Group with the broader community metrics, such as life expectancy, so as to gauge the effectiveness of all your efforts?
Yeah, what a great question. Yeah, so I will jump in, and then of course, Stephanie, certainly feel free to jump in and add to that. So one of the things that we are trying to be increasingly intentional about is we are looking at the data and we are developing these strategic plans, right? So as we identify the challenges, really trying to get at the root cause of what's happening in our community. And asking the question, like, why is this happening, right? Why is this a problem? But also, like, why is this a problem here? So, like, are there specific conditions, specific local conditions in our community that might be different than they are, in another community that are really contributing to this problem? So by doing that, we believe that the tactics and the strategies that we're developing really respond to those local conditions. Of course, one of kind of the next big steps in the journey for us is looking at our strategies and our action plans and developing some process measures through them, right? So we'll monitor those process measures, and then we're playing the long game here, right? So we won't know for many, many years about life expectancy, but We will watch all of those leading indicators and those process measures and see that hope that we're moving in the right direction. And then, of course, that's where our strategic planning process comes in, is a chance to constantly be evaluating that data and our strategies so that if something is not working in the way that we intended, we've got those early warning signs and we can adjust course.
I think that when thinking about the Communities of Excellence Common Scorecard, the idea there is that if communities aren't at a place yet or ready yet to develop their own community scorecard, that the Common Scorecard could be a good starting point for them for comparisons, for communicating the situation in their community. And what I would envision is kind of cascading measures from each of those high-level metrics that are more specific to that community, and then really cascade down to their different strategies and action plans. So that's our vision as well for the Common Scorecard.
Well, Stephanie and Kim, thank you both for such an engaging presentation today, and we'll look forward to learning more. I think we need to make Communities of Excellence an annual sort of presentation here so that you can keep us up to date on all of your exciting developments and progress.
We'd love that.
Yeah, thanks for having us today.
As a reminder, the Institute has a number of certification courses that are fully online, self-paced, including Lean Six Sigma, project management, diversity, equity, and inclusion, and much more. To learn more about these courses and our upcoming 10-day online course, Mastering Strategy and Healthcare Certification Program, offered in partnership with the George Washington University Center for Excellence in Public Leadership. Please visit the Institute website at baldrigeinstitute.org. Thanks to everyone for attending today. As a reminder, the recorded version of today's presentation and the slides will be available on the Institute website early next week. And once again, thanks to all of our sponsors, especially the members of the Mac Baldrige Society, who are the trustees of the Institute for Performance Excellence. It is their generous support that makes presentations like today's possible. Please be safe and have a great day, everyone.